Fatty liver symptoms, signs, causes. What is a fatty liver? A fatty liver is a condition in which the liver accumulates an excess of fat. Livers will naturally contain some fat. If the fat accumulation is more than 10% of the liver's total weight, however, this is considered a fatty liver. Sometimes, this condition may not result in medical complications, but this is not always the case. One of the possible complications of this condition is steatohepatitis, which is the inflammation of the liver. This may lead to liver damage. A damaged liver may become hardened and scarred, which is a condition called cirrhosis. Cirrhosis can be a serious medical condition that may result in liver failure. A patient with untreated liver failure may experience swelling of the brain, bleeding disorders, and infections. This condition will not directly result in any symptoms, however, symptoms due to liver damage may become noticeable. If the damage to the liver becomes severe, which may take years, the patient may experience fatigue, abdominal discomfort, and weight loss. Some patients may also have confusion and general weakness. There are two general types of fatty liver. If the condition is due to alcohol abuse, it is referred to as alcoholic fatty liver. When the condition is caused by other factors, it is called non-alcoholic fatty liver disease, NAFLD. This condition may be caused by more than one factor. Alcohol abuse often causes it. A diet that is excessively high in fat may help contribute to the condition, however, it cannot be the sole cause. Malnutrition and rapid weight loss may also be contributing factors. Other medical conditions may also be associated with this, such as diabetes, insulin resistance, and obesity. Diagnosis may be incidental, as it does not cause symptoms by itself. More likely, a patient will have blood tests run for other reasons, and the doctor may notice an abnormality. A physician may also discover an enlarged liver during a physical exam. Patients will likely need to undergo additional tests, such as an X-ray or ultrasound, to confirm the diagnosis. The doctor will also need to take a liver biopsy, or a small sample of tissue, to test. There is no standard treatment for this condition. Instead, the treatment plan will depend on the factors causing the condition. If the condition is caused by alcohol abuse, the patient will need to take steps to cease drinking. Typically, about 6 weeks of being sober is sufficient for the liver to decrease its fat content. If the patient is overweight or obese, a doctor can help the patient develop a low-fat diet plan to safely lose weight. Regular exercise can also help reduce this condition. If the patient has high blood cholesterol, he may be prescribed cholesterol-lowering medications. Patients who are in the process of healing their liver should have regular medical checkups to evaluate progress. What are fatty liver symptoms? Fatty liver is a condition in which fat accumulates in the tissues of the liver. When this occurs, the various fatty liver symptoms might include fatigue and abdominal pain, and it occasionally results in weight loss. These symptoms are the same regardless of the cause of fatty liver. It can be difficult to diagnose, because for many people, these symptoms are extremely mild and not enough to cause alarm. For others, fatty liver symptoms are non-existent. Symptoms develop from the enlargement of the liver because of the fatty tissues. There are a number of causes, with one of the most common being excessive alcohol consumption. Fatty liver caused by other factors is also called non-alcoholic fatty liver, and it simply occurs when the liver has difficulty breaking down fats and begins to store them instead. This can result from the metabolic imbalance, obesity, high cholesterol, excessive consumption of aspirin, tamoxifen or corticosteroids. It also can be associated with diabetes or even pregnancy. There are different degrees of fatty liver syndrome, and it is suspected that every individual has some degree of fat in his or her liver. Some forms are harmless, but some are not. Non-alcoholic steatohepatitis is the accumulation of enough fat that the liver becomes inflamed, resulting in the fatty liver symptoms of abdominal pain and aching. This type can impair the liver's ability to function and can lead to non-alcoholic fatty liver disease-associated cirrhosis. In this stage, scar tissue builds up in the liver along with the fat, which can lead to liver failure. Fatty liver symptoms alone are not enough to diagnose the condition. Blood tests can help detect abnormalities in liver function, and tests such as magnetic resonance imaging, MRI, computed tomography, CT, or ultrasound can help to determine whether excess fat is present in the liver. If these tests come back to show that there are problems, the doctor can perform a liver biopsy to take a sample of the tissue. Upon examination, it can be determined whether fatty liver is present. In spite of the mild form that fatty liver symptoms usually take on, chronic fatigue or discomfort should not be ignored. Although it is generally not life-threatening on its own, fatty liver is a condition that usually can be reversed with a removal of the causes. When individuals stop drinking, lose weight or take other measures to control diabetes or triglyceride levels, the liver has the ability to repair itself, if the causes are not removed. However, fatty liver can become cirrhosis, which in turn can lead to liver failure. What causes fatty liver pain? Fatty liver pain occurs when a person is afflicted with fatty liver disease, or FLD, where large pockets of lipids known as vacuoles accumulate in the liver tissue and it no longer processes and removes fats from the body effectively. Often, the cause of discomfort from the disorder is not actually in the liver itself, but in the surrounding tissues and organs irritated by the swollen, inflamed liver. The organ may become damaged and scarred from the presence of the fat vacuoles, which may cause pain. If the condition goes untreated for long enough, the organ may stop functioning properly, which can also lead to fatty liver pain. The buildup of fat in the liver caused by FLD often leads to inflammation of the organ, which in turn irritates the organs and tissues nearby. The organ may also grow much larger than normal over time as the fat levels increase. This abnormal growth in turn puts pressure on the area around the liver. Typically, this type of fatty liver pain is felt in the upper right portion of the abdomen. It is generally not a sharp pain, at least not early in the course of the disease, but presents more as a dull ache. This may cause some patients not to seek diagnosis and treatment until the condition has progressed further, leading to additional damage and pain. Another potential cause of fatty liver pain is damage to the organ. The abnormal buildup of fat vacuoles throughout the liver can cause the nearby healthy tissue to become damaged and scarred. The pockets of fat also often cause the organ to become inflamed, which can lead to further damage if it is not treated promptly and effectively. Though symptoms of fatty liver disease may be minimal or even non-existent at first, as the disease progresses it can significantly affect the organ's ability to function and may even cause it to shut down. In cases where the disease has progressed to this point, patients may begin to experience sharp, severe pain that comes on rapidly in the area of the abdomen close to the liver. If this type of fatty liver pain occurs, it is critical that the person seek medical attention immediately. Partial or complete liver failure can have a significant impact on the body and may ultimately be fatal. What are fatty deposits on the liver? Fatty deposits on the liver refer to additional fatty tissue which takes up residence on the liver itself or in the liver's cells. This can be caused by eating a fatty diet, drinking alcohol, taking certain medications, and sometimes pregnancy. In most cases these fatty deposits are considered benign and are reversible. Sometimes, however, they can indicate a serious health condition. Almost anyone can have fatty deposits on the liver, but there are some who are at an increased risk. Those who eat a diet high in fat may be more likely to develop them, as well as anyone who drinks excessive amounts of alcohol. In fact, most drinkers eventually have fatty deposits on the liver to some extent. They will generally go away with time if dietary habits are changed. This means a healthier diet and reduced drinking of alcoholic beverages. Sometimes fatty deposits on the liver can indicate a serious health condition. Liver cancer, cirrhosis of the liver, and other conditions can all cause fatty deposits to accumulate. These deposits are similar to the fat which forms in other areas of the body. When excess fat is consumed, it cannot be easily burned off as energy, so it accumulates on various cells around the body. The liver is one of the main organs to be affected because it filters toxins and other materials, so it takes the burden of filtering high-toxin fatty foods. Those with type 2 diabetes and insulin resistance are also at an increased risk of fatty deposits on the liver, as well as those who are obese. If actions are not taken, this fat can eventually lead to liver malfunction. When this occurs, dialysis and eventually transplant may be needed. Most cases of fatty deposits on the liver are reversible and do not cause permanent damage. They generally accumulate slowly and do not lead to additional complications for many years. Those who have fatty deposits on the liver should discuss potential actions that can be taken to remedy the situation before it becomes worse. Generally, dietary changes, exercise, and avoiding substances which are hard on the liver are recommended. If fatty liver is caused by medication, another drug may be tried to reduce side effects. Pregnancy-induced fatty liver usually goes away after giving birth. If a more serious health condition is suspected or if additional symptoms are present, treatment may be necessary. Actions that can be taken to remedy the situation before it becomes worse. Generally, dietary changes, exercise, and avoiding substances which are hard on the liver are recommended. If fatty liver is caused by medication, another drug may be tried to reduce side effects. Pregnancy-induced fatty liver usually goes away after giving birth. If a more serious health condition is suspected or if additional symptoms are present, treatment may be necessary. Visit the website. Click below.